Welcome to a new episode of HumanX Medical Case Studies. Today we're looking at a case that's not as unusual as you might think. In 2023, according to the American Academy of Orthopedic Surgeons, about 500,000 people were treated for ladder-related injuries. As in our case of a 58-year-old man, many of these accidents result in polytraumatic injuries and complex fractures. The orthopedic department of a major hospital contacted us one day after the patient had been brought to the emergency room. The surgeons asked for a model of the fractured pelvic bone to discuss and practice the procedure with their residents. Due to the internal injuries, the team had to wait until the patient was stable enough to undergo the surgery. This gave us just under 5 days to create and ship the model. The key requirements for the model were to represent the current state of the fracture, including the shape, size, and orientation of each fragment. The model also had to allow for repositioning of the fragments to reshape the roof of the acetabulum. Finally, the selected material had to mimic the bony structure to allow for screw and plate placement. The CT scan provided has a layer spacing of 0.76 millimeters. This is perfect for segmenting the details needed to create a surgical training model that meets the requirements of the surgeons. According to the CT scan, this fracture can be classified as an anterior wall acetabular fracture. It is an elementary acetabular fracture showing a break in the front part of the hip socket's bony rim or bone column. It's a rare type of fracture, making up less than 10% of all acetabular fractures. Our HumanX score for 3D modeling and printing shows that the model is not so easy to print. The material requirements and the flexibility of the fragments must be taken into account when setting up the print job. Apart from that, the bony structures are clearly visible in the DICOM images, and the segmentation does not pose any major challenges. Let's dive into the first step of creating the patient-specific training model. The software we are using in this video to demonstrate the segmentation is 3D Slicer. It is open source, and you can find a download link in the description below. To differentiate the bony structures from the surrounding tissue, we use the Grow From Seeds algorithm. Therefore, we create a total of 9 different markers, 1 for the hip bone, 1 for the femur, and 1 for each of the 7 fragments. Every structure is marked on the CT images in all 3 perspectives. To help the algorithm determine the correct areas, it is better to also mark areas where different structures are close to each other or connected. When using the Grow From Seeds algorithm, there is no reason to highlight the relevant structures in each layer. With a total number of 788 images of this particular CT scan, this would be very time-consuming. Instead, we will review and adjust the final result during the execution of the algorithm. This is important to ensure that all relevant areas are highlighted. The segmentation of the fracture took about 2 hours. The final rendering of the segmented structures shows some defects that will be removed in the next step. The last step in the 3D Slicer software is to export the created model as a STL or object file. Now that we have our segmented model exported as an STL file, it's time to refine it for 3D printing. For this step, we're using Mesh Mixer, a powerful free tool designed for sculpting and adjusting 3D models. You can find a download link in the description below. First, we open the STL file and check for any defects. CT scans can sometimes create rough edges or holes in the mesh, especially around complex fractures like this one. We begin by using Mesh Mixer's Inspector, a tool, which automatically identifies and fills these gaps, ensuring the model is a solid, watertight object ready for printing. This process is crucial, as even tiny defects could cause printing errors or structural weaknesses in the final model. Next, we optimize the model's surface. We simplify the mesh by reducing the number of triangles without compromising important details in the bone structure. This step keeps the file size manageable and shortens the printing time while preserving the essential features needed for surgical planning. Once the model is cleaned and simplified, we add internal supports to allow fragment repositioning as required by the surgical team. Using little spheres, we create flexible joints around each fracture line, giving the model the necessary articulation for practice with fixation techniques. With these adjustments complete, our model is now ready for the final stages of printing preparation. The final 3D model now features a very detailed replica of the pathological situation. The post-modeling process took about 30 minutes. We'll export the data in a format compatible with the 3D printer, ensuring the surgical team receives a precise, reliable training tool. And that's how we transform a segmented CT scan into a fully functional, patient-specific 3D model using Mesh Mixer. With our model ready, we move on to 3D printing, using FDM technology and PLA filament. This setup provides the durability needed for surgical training at an affordable cost. We adjust the printer settings to replicate the bone's internal cortical and spongy structure. To mimic the denser cortical bone, we set a thicker wall perimeter. For the inner spongy ossa, we select a lower density infill pattern, which keeps the model lightweight yet structurally sound. These adjustments give the model a realistic feel, responding well to drilling and fixation. As the printer builds layer by layer, you can see the bone structure take shape. This precision ensures that the final model is both functional and anatomically accurate, providing an essential hands-on tool for surgical planning and practice. With our 3D printed parts complete, we now move to assembly and testing. The model consists of two main components, the femur and the pelvis, with the fractured acetabulum. We begin by fitting these parts together, aligning them precisely to replicate the patient's anatomy. Next, we demonstrate the flexibility designed into the fracture fragments. Each piece can be easily repositioned, allowing surgeons to practice alignment and fixation techniques as they would in a real procedure. This flexibility is critical, enabling the model to serve as a dynamic training tool for both planning and hands-on practice. After confirming stability and movement, the model is now ready for the surgical team. To conclude, creating this patient-specific model took around 18.5 hours, from segmentation to final 3D printing. This hands-on replica allowed the surgical team to explore and practice various approaches before the actual procedure, ultimately reducing the invasiveness of the surgery. With minimized incisions, the operation time and the patient's recovery period were significantly shortened. If you have an interesting case you'd like to share with us, please reach out. And if you found this case study insightful, be sure to like and subscribe for more innovative applications in medical 3D printing. Thank you for watching.